2018 Kivu Ebola outbreak epidemiology. First cases and transmission. The Democratic Republic of Congo declared an Ebola outbreak on 1 August, when 4 cases had tested positive for the Ebola virus in the province of North Kivu. That same day, 26 individuals with hemorrhagic signs, along with 20 deaths, were reported in the area of North Kivu. On 2 August, Oxfam indicated it would be taking part in the response to this latest outbreak in the DRC. By 3 August, the virus had developed in multiple locations. Cases were reported in 5 health zones: Beni, Butembo, Oicha, Muzinine and Mabaliko, in North Kivu province, and additionally, Mandema and Mombasa in Ituri province. However, 1 month later there had been confirmed cases only in the Mabaliko, Mandema, Beni and Oicha health zones. The 5 suspected cases in the Mombasa health zone proved not to be EBD. It was not possible to confirm the 1 probable case in the Muzinine health zone and the 2 probable cases in the Butembo health zone. No new cases had been recorded in any of those health zones. The first confirmed case in Butembo was announced on 4 September, the same day that it was announced that one of the cases registered at Beni had actually come from the Kalungata health zone. The DRC Ministry of Public Health confirmed that the new Ebola outbreak is caused by the Zaire Ebola virus species. This is the same strain that was involved in the early 2018 outbreak in western DRC. Health authorities in the DRC confirmed they would use the Zbov vaccine once again. On 4 August, the World Health Organization, WHO, indicated that the current situation in the DRC, due to several factors, warranted a high-risk assessment at the national and regional level for public health. Currently the EBD outbreak runs across 2 provinces, and 14 health zones. The table below reflects cases that were not able to have a laboratory test sample prior to burial as probable cases. On 23 December the EBD outbreak spread to more health zones, and currently there are 18 such areas that have been affected. The current population in DRC is more than 84 million people. Transition to large-scale outbreak. The Uganda Ministry of Health has issued an alert for extra surveillance as the neighboring outbreak in the DRC is just 100 kilometers, 62 miles, away from its border. On 7 August, the DRC Ministry of Public Health indicated that the total count had climbed to almost 90 cases. 2 days later, on 9 August, it was nearly 100 cases. On 16 August, the United Kingdom indicated it would help with EBD diagnosis and monitoring in the Democratic Republic of the Congo. On 17 August, the WHO reported that contacts numbered about 1,500 individuals. However, there could be more in certain conflict zones in the DRC that cannot be reached. Some 954 contacts were successfully followed up on 18 August. However, Mandema Health Zone indicated resistance. As a consequence, contacts were not followed up there per the World Health Organization. On 3 September, WHO stated that 16 health workers had contracted the lethal virus. Health workers must don PPE for protection during treatment of those affected by the virus, as well as various other tasks. On 4 September, Butembo, a city with almost 1 million people, logged its first fatality in the Ebola outbreak. The city of Butembo, in the Democratic Republic of the Congo, has trade links to Uganda, which is borders. On 24 September, it was reported that all contact tracing and vaccinations would stop for the foreseeable future in Beni, due to an attack the day before by rebel groups that left several individuals dead. On 25 September, Peter Salama of the World Health Organization indicated that insecurity is obstructing efforts to stop the virus and believes a combination of factors could establish conditions for an epidemic. On 18 October, the Centers for Disease Control and Prevention raised its travelers alert to the Democratic Republic of the Congo from a level 1 to level 2 for all U.S. travelers. On 26 October, the World Health Organization indicated that half of confirmed cases were not showing any fever symptom, thus making diagnosis more difficult. On 6 November, the Centers for Disease Control and Prevention indicated that the current outbreak in the east region of the DRC may not be containable due to several factors. This would be the first time since 1976 that an outbreak has not been able to be curbed. Due to various situations surrounding the current EBD outbreak, WHO indicated on 13 November that the viral outbreak would last at least 6 months. On 23 November it was reported that due to a steady increase in cases, it is expected that the current EVD outbreak in DRC will overtake the Uganda 2000 outbreak of 425 total cases, to become the second biggest EVD outbreak behind only the West Africa Ebola virus epidemic. According to the current available statistics, women are being infected at a higher rate, 60%, than their male counterparts due to the EVD outbreak, a report issued 4 December indicated. On 29 December the DRC Ministry of Public Health declared 0 new confirmed cases detected because of the paralysis of the activities of the response in Beni, Butembo, Kamanda and Mabaliko, and no vaccination has occurred for 3 consecutive days. Countries with medically evacuated individuals. On 29 December, the U.S. evacuated an American physician that was exposed to the Ebola virus, but is as yet non-symptomatic. The individual has been taken to University of Nebraska Medical Center. Bordering countries. On 11 August, a UN agency indicated that steps were being taken to assure that those leaving the DRC into Uganda are not infected with Ebola. This is being done via active screening. On 13 August, the DRC reported a total of 115 cases of the virus within its borders so far. 3 individuals in Uganda that were suspected of contracting the virus were tested, with negative results. On 22 August, it was reported that the government of Uganda had opened 2 Ebola treatment centers at the border with the Democratic Republic of the Congo, though there are as yet no confirmed cases in the country of Uganda. According to the International Red Cross, a most likely scenario entails an asymptomatic case will at some point enter the country of Uganda undetected among the numerous refugees coming from the DRC. On 20 September Uganda indicated it was ready for immediate vaccination, should the Ebola virus be detected in any individual. On 21 September, officials of the Democratic Republic of the Congo indicated a confirmed case of EVD at Lake Albert, an entry point into Uganda, though no case has been confirmed within Ugandan territory. On 2 November, it was reported that the Ugandan government would start vaccination of health workers along the border with the Democratic Republic of the Congo as a proactive measure against the virus. Other countries that border the Democratic Republic of the Congo are South Sudan and Rwanda.